Hello, I'm Jimmy Sangster, Product Manager for Functional Knee Braces for Bledsoe Brace Systems. I'm here to talk to you today about the Primas-D PCL brace and go over some fitting tips. When fitting the Primas-D PCL brace, you want to have the patient sitting down and you want to make sure that the patient is on the edge of their seat. Being on the edge of the seat gives the thigh a much better shape to fit inside of the shell of the brace. So I always have the patient move out on their seat. With the Primas PCL brace, you want to fit the brace at about 10 degrees of flexion. Most of our braces we fit with the knee at 90 degrees. With the PCL, you have to remember to fit the brace in 10 degrees of flexion. So as straight as all the way here, 10 degrees will be about right there. To begin the fitting, have the patient positioned right and open up the brace. You'll notice that there's 3 over center buckles on the Primas and a D-ring on the back side of the brace. On the front side, the anterior portion of the brace, you want to make sure that we loosen the straps on the brace. Both the proximal tibia strap and the distal femur strap. Now that we have the patient positioned properly, the brace is opened up, we are going to begin applying the brace. When you apply the brace, you want to make sure that the pads don't fold up underneath. This is a common mistake that a lot of our patients make, is they fold these up underneath. Grab those and make sure they're nice and flat on the patient. And you'll have to wiggle it out onto the patient's leg. The most important part of fitting a brace is making sure that you have the brace positioned correctly. I always tell my patients you want to be high and back on the leg. High means we are up the leg, so we are more proximal on the leg. Back means we are posterior on the leg. As you can see, this strap is fighting against me, pushing it back even further. So what do? I loosen this strap up and I can push it back even further. So I always start off high and back. Most important thing you can teach your patient. There's a certain sequence that we strap the Primas-D brace together. The first strap is our Velcro strap. Again, the knee is at 10 degrees of flexion. This strap will come across and Velcro to the opposite side. Second strap we're going to apply to the brace or tighten down as the number 2 strap is the bottom tibia. The third strap that we work with is the distal femur strap. The fourth strap is the furthest proximal strap on the brace. Pull this across. I always like to roll back here so you don't pinch yourself. So I'll always reach underneath, grab the over center buckle, and make sure it clicks into place. The fifth strap is the anterior tibial strap. And the finishing move is the PCL control strap.